I will discuss the epidemiology, clinical features, prevention and control measures of mental disorders, and also the National Mental Health Program and the salient features of the Mental Health Care Act. So, mental disorders include a group of disorders. Basically, all of them have something in common. That is, there is abnormal thoughts or perceptions or behavior, attitude of the person who is affected. So, these are the common mental disorders. These are the groups: mood disorders, anxiety disorders, psychotic disorders, neurological disorders, and developmental disorders. And these are the diseases within these groups. So, the determinants of mental health disorders are many. So, individual attributes are there, like the way the person can cope with the stress, can manage one's thoughts, emotions, perceptions, etc. And there are social, cultural, political, familial influences and some environmental factors which also affect, and some other factors like stress, genetic disposition, nutrition, perinatal infection, etc. And the consequences. Mental health disorders carry a lot of stigma and discrimination. And also there is lack of access to health and health services, and human rights is often violated. So I'll now discuss some common mental disorders. So depression, this is a very common one and a huge burden. Around 264 million people are affected by depression. So the manifestations are the person feels sad, loss of interest and pleasure, loss of interest in any activity, and even loss of interest in life. And the person has a feeling of guilt, may have low self-esteem, and also accompanied with it may be disturbances of sleep, appetite, tiredness, poor concentration. They cannot function properly. And such a patient presents with multiple physical complaints. And on examination and history taking, it is found out that this person actually does not have any physical ill health. Rather, it is mental ill health, that is depression, that the person is suffering from. And depression can be long-lasting and even recurrent. Once a person has recovered from depression, may fall back on it with slightest trigger. And severe depression often leads to suicide. So, prevention is by protection and psychosocial support given by the family, by the community, and especially when there is a trauma. After trauma, the person needs a lot of psychosocial support. Trauma in the form of physical and sexual abuse. Those who have faced disasters or warfare, conflicts, etc., they suffer from a lot of trauma, so they need to be supported. And treatment for mild to moderate depression, psychotherapy, cognitive behavior therapy, etc. are effective. While for moderate to severe depression, antidepressant medication will be required. Other than that, the stress factors should be identified. It may be financial problem, it may be relationship problem or difficulty at the workplace, but that stress factor needs to be identified and that needs to be removed. Then only depression can be totally cured. And the sources of support also should be identified. The family will be a source of support, but there may be some particular family member who is a greater support. So that person needs to be identified so that that person can give social support, psychological support to the affected individual. Similarly, some friends may be there, or say some colleague, some teacher or someone. So this social support system and the individual who can be a great support needs to be identified, and that person needs to be introduced to this program, prevention program for this person, affected individual, and help the affected individual. And social networking, social activities should be maintained. Next is bipolar disorder. So this is named as bipolar disorder because it is a spectrum with two poles, entirely opposite manifestations. So one end there is mania and the other end there is depression. So manic episodes, these involve hyperactive state. The patient is in euphoria, elevated or irritable mood, and maybe having rapid speech, and they have very inflated self-esteem and decreased need for sleep. So this is the elevated form, that means the manic episode, the manic form, and at the other end that is a typical depression. But sometimes such manic attacks may happen without the depression phase also. Then also it is known as a bipolar disorder. For management, the treatment of the acute manic episode has to be done, and prevention of relapse of such episode and psychosocial support should continue. Then anxiety disorders. So this is also very high prevalence. 40% people suffer from anxiety attacks sometime during their lifetime. Manifestations may be physical symptoms like excessive sweating, palpitation, breathlessness, dizziness, chest pain, etc. Or there may be mental symptoms, fear, panic, anxiety, worry, and behavioral symptoms also, like they cannot concentrate, inability to concentrate in their work, inability to fall asleep, etc. And management is, pharmacological management is by anxiolytic medication, and other than that, relaxation technique, stress management technique, and psychosocial support. Next, schizophrenia and other psychosis. So here the manifestation is the person has distortion in thinking, perception, emotion, etc. They are dissociated from the reality, and they often have auditory or visual hallucinations, and they find difficulty to concentrate on work or study. And management is again by medication, psychosocial support, and assisted living. Then dementia. So here the causative factor is diseases or injury of the brain like Alzheimer's disease, cerebrovascular accident, head injury, etc. And also due to aging, there may be senile dementia. And manifestation is that it is usually a chronic progressive form. And so there is no remission or relapse. It gradually progresses and deteriorates. And it affects the cognitive function. It affects memory, thinking, understanding, rational decision making, etc. For managing it, no treatment is currently available. Just psychosocial support to the person or the elderly person or the person who has been affected should continue. Then developmental disorders. So this usually starts in childhood and persists into adulthood. This also there is no remission, relapse. It is a chronic progressive condition. So there are two different forms. One is intellectual disability and the other is pervasive developmental disorder. So intellectual disability, it manifests with low cognitive functioning and adaptive behavior, while pervasive developmental disorder affects the social behavior, the social interaction. So this child is not able to communicate with others, interact with others. And they do have some degree of intellectual disability also. So management is totally supportive. So family involvement in care is important, and especially one particular person with whom the child is more attached should take care of the child. And the causes of distress and the causes of well-being should be identified. There are some issues which makes the child go into distress. So those should be avoided and removed. And those factors or activities or environment that makes the child feel good, those should be promoted, and the child should be kept in a conducive environment, and so that the child can also be assisted to learn. And the daily routine should be structured with activities and environment and places where the child is most comfortable, and that should be continued, because if there is any deviation from this child tends to get distressed. So that should be avoided. So regular follow-up services should be provided, health services for the children, and the parents also should be counseled. And in case of adults with developmental disorder, they should also be followed up regularly. And the community should be sensitized towards it. They should also respect the condition of this person and not make this person feel distressed.